who you are.
I'm still trying to find out. Okay, you want me to start?
Yes, we can start.
Okay. So my name is Rogier Hoenders. I'm a psychiatrist and researcher at the Center for Integrative Psychiatry in Groningen, in the north of the Netherlands. I work there as a therapist for patients. I also do scientific research on the effectiveness and the safety of alternative medicine within psychiatry. And I also organize, together with my colleagues and friends, every year a conference in Groningen on integrated psychiatry also. Integrated psychiatry means the integration of alternative medicine with Western psychiatry, like a combination of the best of two worlds to give patients more options to treat mental symptoms. Psychiatry is a field that is always a little bit different in a way. People feel very confident when they go to a surgeon or to the general practitioner or the dentist, but going to a psychiatrist is always a little bit different because people think they are cuckoo, crazy and strange, and so most people feel uncomfortable with this, which for me there is absolutely no reason for that, because sickness can be either in the body or in the mind, and most of the time it's in both at the same time. So for instance, people with a heart disease get depressed and fear, and they get tired and all these things. So you see that disease of the body always also reflects on the mind. And at the same time, people with, let's say, depression or anxiety, they have a lot of physical symptoms as well. So I don't think disease is ever only in the mind or only in the body. So most of the time it's in both at the same time. So in 2006, in March, we had the first conference on integrated psychiatry. It was a huge success. People really much liked. It was also a very strange conference because we had a combination of psychologists, psychiatrists, scientists, but also alternative practitioners and patients, family, and even we had meditation teachers. For instance, Lama Ganchen Rinpoche was there, and also people who are very much into mindfulness meditation. So we had really like a mixture of different cultures at the same time. And people were very enthusiastic for this. It was the first time in Holland we had a big conference. There were 1,200 people that first time who want to learn from each other and who want to integrate their knowledge to help patients in a better way, which is suitable for this time. So the theme on the first year was the best of both worlds. And then the second year we looked for in search of new solutions. And the third year we had a conference with the theme New Perspectives on Body and Mind. Again, trying to illustrate how all these different cultures and different therapists have their own perspective on disease and on health and wellness, and how if we put all these perspectives together, we can have a better result. And now we are working a lot for the next conference, and the major theme will be self-healing capacity, which means that we all have this innate ability, like we got this when we were born, to heal ourselves. So on a very basic level, let's say if we have a big wound somewhere, if we have a cut in the belly and there's a lot of dirt and problem there, then the surgeon will clean this wound, make it, put everything away, then he ties it up, but it has to heal itself. It's not the surgeon that makes it heal, it's the patient itself that makes it heal. And the reason we got this theme is that in medicine, in Western medicine especially, we focus mainly on treating disease, giving medicines and doing surgery and stuff like this, but we don't really have methods to increase the self-healing capacity of patients, which can be very useful. And I think mainly we refer to this capacity as the placebo effect, which means that when you give somebody a treatment which is fake, like a sugar pill instead of a real antidepressant, then still a lot of people can be healed. And you could call this the placebo effect, but we could also say this is the self-healing capacity of the person, or maybe the person and all the people around this person who can help the person to be healed. So this is the reason we have this for the conference. One of the major speakers on this conference will be David Servan-Schreiber, who is a French psychiatrist, and he was very famous for his book Guérir in French, which means healing, and in Dutch it's Uw brein als medicijn, which means also that we have this innate ability to heal ourselves. And he was reflecting on alternative practitioners within psychiatry that can be used for patients to be healed. The second major speaker will be James Gordon, who is the director and founder of the Center for Mind-Body Medicine in Washington. And he will be speaking about his book, which is called Unstuck. And that means that many people who are very depressed or have anxiety, they are like stuck in the swarms of their depression, and we have to get them unstuck. And he gives a lot of therapies, he's describing in this book, which can be used without medication, but just therapies to heal yourself. And the third major speaker will be Barbara Fredrickson. She's a professor of psychology, and she'll be speaking about positive psychology. Again, within Western medicine and psychology, we are mainly focused with things that are not, we don't like, things that are sick, problems we have, and we want to put them down. And of course that makes sense in a way, but we can also increase what is beneficial. So we try to make positive emotions stronger. And this is a new field in psychology, which is very rapidly developing. And this is called positive psychology. So these three are the major speakers. And then there will be also 13 workshops on many different themes. For instance, also again on meditation, as meditation is becoming very popular in medicine, also in psychiatry. Mainly mindfulness meditation, but we also have again the Tibetan Lamas Lama Ganchen Rinpoche and Lama Michel Rinpoche, who will be teaching their meditation practice, which is called Nalso self-healing, making peace with the environment. So what we see very often is that people who know that their friend is going to a psychiatrist, they think these people are crazy and they cannot be helped, there's nothing to be done anymore, they'll be crazy for the rest of their lives, and we have to stay far away from them. This is what you usually hear. But this is not true, because psychiatric problems like depression, anxiety, sleeping problems, personality disorders, addiction disorders, they can be treated as well as normal medicine, like infection in the lungs or a broken leg or whatever. So psychiatry is almost as successful as other medicine, but there is still this strange attitude around psychiatry that people really try to stay far away from them. And this is not at all very logical, because when we look inside ourselves, all of us have problems. We all have a personality in which we have more positive qualities, and we also all have problems. Everybody sometimes is scared, sometimes has fear, sometimes has anger. There can be a lot of problems. Many people have addiction problems in this Western world. So we cannot divide into the good guys and the bad guys, or the people who are healthy or who are insane. To some extent we are all sick or all healthy, whatever you like. It's just like a gradual distinction between people who are so sick they really need attention, they need medication or different things, and people who don't. But again, this is a gray area, and the distinction is very gradual.
Okay, Thank you and good luck for your profession.
That's all.